Hello, my name is Gary Peterson, and Priya Menon had asked me to be part of her Cure Talks, where we could talk about our journeys, meaning people that she knows that have been advocates and have some things that may be of interest to the myeloma universe. My story began 18 years ago when I found out just from being short of breath and a little dizzy to go to the grocery store where they allowed you to check out your blood pressure. And that was the first time my blood pressure had ever been elevated. So I went to the doctor, and the doctor indicated that I had, some markers that were out of line, and as a result, he wanted me to get some blood tests. And when it came back, those blood tests indicated that I had very high calcium, that my kidneys had failed, and that I was in kidney complete shutdown. As a result, they did some testing, and they said there was 4 or 5 things that it could be, and the worst of which was myeloma, and came to find out that's exactly what it was. But at the time, unlike today, the only place you could find statistics on it were with the National Institute of Health, the NIH, or on the internet. There was a couple places that showed their performance. One of which was Mayo Clinic, the other which was the University of Arkansas for Medical Sciences. And Medical Sciences had indicated that they were now treating people and getting 7 years of life expectancy, whereas the folks at Mayo had published something that said in the last 20 years, the life expectancy had not budged from 33 months. And as a result, I pretty much decided that I was going to go to Arkansas. And one of the reasons is that there was a great doctor there called Dr. Bart Barloghi that my daughter, who was on the health desk of the Wall Street Journal, recommended was a great person to see. Now, my multiple myeloma, since that time, the National Institute of Health has indicated that life expectancy has gone up from 3 years to 5.5 to 5 3/4 years. And that's pretty outstanding. And actually, I think it's something of a myeloma miracle when you consider that myeloma happens to be a orphan disease, is what they call it. There's 7,000 orphan diseases, myeloma being one of them, and it has, in 1983, it had only 35 drugs that were specific to those 7,000 diseases. So they came up with a thing called the Orphan Drug Act of 1983, and at that time they were trying to get money and additional resources to companies that had drugs in clinical trial that could in fact result in improved life expectancy for those 7,000 diseases that had some form of of having nothing to take without drugs approved. Now, the only way drugs can be approved is through clinical trials, and as a result, of those 500 drugs, the myeloma community was able to get a total of 19 new drugs in that period, that 20-year period between 1983 and 2023. So what I think that says to me is that there's really been something of a myeloma miracle. And one of the things is you'll see that myeloma has historically had a lot of great organizations. There was the International Myeloma Foundation, Leukemia Lymphoma Society, the MMRF, and also HealthTree. So all of those were working and had a lot of people from both the patient community and the outstanding doctors and researchers, and they're one of the reasons I think that it's gone so far. And what I'm enthusiastic about now is that in that time frame, many new drugs were developed, and those current drugs have been types of drugs like Velcade and Revlimid, and these new drugs with new methods of action are now coming into play. The method of action for Velcade and Revlimid were different than the older drugs. And what we've got now is brand new ones, not just variants of the existing type of drugs. And those include monoclonal antibodies, also bispecifics, CAR T, and antibody drug conjugates. Now, what we need to do next, I think, is moving the drugs that are currently approved early on in the process of disease progression. Most of the drugs, frankly, are made by small bio companies, and those companies are helped by the 83 Drug Act, but I've seen, and I've been have noticed that they have a really hard time getting the billions of dollars of funding in order to get their drugs approved, and as a result, they continually put out new forms of public offerings of their stock. And usually, because it takes 10 years to bring a drug to market, they have to do that many times. And each time they do that, they lose value on their drugs, on their company's value, a lot of which are worth 50 million to 100 million to, $500 million. But still, that's a far cry from the capital they need to bring them to fruition. So what I think you'll see, I would hope, in my lifetime anyway, is a way for the government to somehow prevent the dilution and the reduction in stock prices caused by these new issues of stock to obtain money to get these drugs to market. Right now, 30% of patients die in just the first 2 years per the National Institute of Health or the National Cancer Institute. We need to find it earlier in the disease progression so that they can take these drugs that we have currently and any that we have in the future and apply them earlier on in the disease, because the earlier you catch it, the longer you live, sometimes 2 to 3 times if you get it in stage 1 versus stage 3. I had stage 3, I had kidney failure, and I also had 85% plasma cells that were defective and myeloma cells in my blood. So that didn't give me much of an opportunity to live based on that kind of information. So what I think we need in the future is something that they're doing at the IMF, and that is looking at ways to improve and get people to take the tests. And things like normally people don't get it until they're in their 50s, 60s, and 70s. And as a result, people might be able to take simple tests like a light chain test and a test for the amount of myeloma in your blood, which is, and as a result, get to it before it causes damage to the organs. So that's a lot of which I think would help in the future. Finding it first, finding it, and then treating it before it becomes a very virulent disease, because normally they waited for end organ damage before they would treat, and seldom would they find it before it got to the later stages, nor if the person was high risk. And if you're high risk, you only have 2 years to live. As a result, those are some of the things that I think need to be done in the future in order to make this even more manageable and even more of a myeloma miracle than it is today. Thanks.